Thank you for joining us here on KMR Local 4 News. The City of Amarillo is preparing to have a briefing about the coronavirus pandemic, and we're taking you live for this breaking news.
Dr. Brian Weiss, Chief Medical Officer for Northwest Texas. Dr. Michael Emmentier, Chief Medical Officer for BSA. Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We'll turn it over to our panel for brief opening statements, and then we'll take questions from our media members. Start with Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'll be doing better if I'm not on mute. Thank you. Good morning, Amarillo. Well, the question that I get most often is, how are we doing as a city in this time of facing the COVID pandemic? And really, the answer I want to give back to you is we're doing okay. It's obviously affecting us. It has an effect on our businesses, on our economy. It's affecting all of us emotionally and mentally. Many of us who have had the disease, it's affecting our physical health. But for the most part, we're doing okay. I look at our economic data, especially our unemployment numbers. We're leading the state in unemployment. We're at 5%. In the numbers that came out in July. And what that means for us is we're just about 2 points higher than we normally would be. We always compete for the lowest unemployment rates in the state. And so it's important for us as Amarilloans to have our eye on understanding COVID is having an effect on things, but we're coming back. We're coming out of it. I'm thankful to God's blessing over our city that the effects have not been as bad as we thought they were going to be. Our sales tax revenue is down, but it's not down as much as we thought. Our hotel occupancy tax revenue is down, but it's not down as much as we thought. So it's sort of one of those things where the news is not as bad as we thought, and that is our good news. So I am wanting and hearing citizens want our city to be even more open. And we want to communicate that to Governor Abbott. I think he will be making some changes next week after Labor Day. A very important step to further reopening our businesses is going back to school. And this week completes all of our 5 school districts are now open and back in school. I appreciate the administrators and the teachers for what they're doing to be there in person with our kids. But I appreciate you as parents and what you're doing to comply with the systems that they've put in place in order for school to stay open. And that just sort of brings us back to, what is it going to take for us to be okay and for us to continue moving forward as a city and even as individuals? It's just going to take doing what those systems are asking us to do, doing what those leaders in the school district are asking us to do, doing what Governor Abbott is asking us to do. And that might work against where you are individually. Maybe you think more individually and you don't like for people to tell you what to do. But the truth is, and the data is supporting, that wearing a mask is making a difference in our city. It's making a difference statewide in our numbers. If we want to keep high school football on Friday nights, I hope you're going out and enjoying our beautiful fall weather and cheering on our kids. Please wear a mask as you're sitting in the stands, unless you are at a great distance from people. Doing that is going to allow us to continue to open and continue to expand our businesses and continue to recover economically. We're doing okay, Amarillo, but how we continue to do depends on me and it depends on you. So thank you for cooperating. Thank you for sacrificing and doing the things that you might not want to do, but you're thinking of others in doing them. I so appreciate it on behalf of the entire city, every business owner, every school child, our teachers, and people who are just trying their best to make the changes necessary to keep us safe. We appreciate it. And I know our hospitals, our doctors and nurses appreciate it too. That's all I have today, Dave.
Thank you, Mayor. At this time, we'll go to Casey Stoughton, Public Health Director for the City of Amarillo. Kate, how are you today?
I'm good, Dave. Thank you. Glad to be here again to visit with you all this morning. For the numbers, as of yesterday, there were a total of 6,334 cases of COVID-19 reported in our community, 4,098 in Potter County and 2,236 in Randall County. We're glad to report that we have 5,757 recoveries, and we are sad that we have 86 deaths in our community. That leaves us with 491 active cases. The 230 report card will reflect additional cases reported in both the death category and the recoveries category, as well as the total category. Each of the cases do represent a unique individual. Staff take the time out to take out duplicate tests, as we don't count multiple tests for the same person. The public health department, hospitals, our justices of the peace, the system only counts those deaths that are because of COVID-19. For instance, if a person dies as a result of a car accident, but is also positive for COVID-19, then that death would not be counted as a COVID-19 death. The CDC did recently report the majority of individuals who die as a result of COVID-19 do have underlying health conditions. We analyzed those deaths that were reported to public health, and it represents that 62% of the cases locally have underlying health conditions such as high blood pressure, diabetes, and heart disease. For many of the families in our community, 86 as of yesterday to be exact, this is a reality. I think what's important to note here is that even though those families or those patients have underlying health conditions, it doesn't change the fact that they had the COVID-19 changed the course of their illness. The public health does remain operational. You can call 378-632-6300 to be screened and directed to the test site. The testing does remain free of charge. I wanted to also note that the current 7-day average positivity rate at the drive-through is around 30.8%, and that the total community 7-day rolling average positivity rate is at 10.65%. We do need the normalcy in our community, and I appreciate Mayor Nelson for her words and her encouragement, especially with school opening and businesses needing to remain open. We do need to do so with the continued masking, social distancing, limited in-person meetings, and a consideration for others. We have had new cases in the 40s and 30s and lower 40s for the early part of August. The latter part of August, we saw cases in the upper 40s and 50s. And yesterday we saw 92 additional cases. So we certainly appreciate the need for those additional measures. Thank you, Dave.
Thank you, Casey. This time we'll go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
I'm doing very well. Thank you, Dave. So the big news this week at Northwest is we're moving to antigen testing. So just to remind you, all the testing up to this point started with that lovely nasal pharyngeal swab. That's a swab that is as close to a brain biopsy as you can get without anesthesia. So, and then what we would do is we would try to amplify the genetic material of the virus off that swab and then detect that genetic material. So the fastest we can do that amplification using PCR, polymerase chain reaction, takes at least an hour. And then as many of you know, it can take days if we send it out. So now what we're going to is antigen testing. That means we're going to try to detect part of the virus that's not the genetic material. So it's usually a protein. In this case, it's a protein that's inside the capsule of the virus. It starts with that same lovely swab, but this time we skip the amplification step. All we're trying to do is detect that protein. Now I can tell you some of the early antigen testing only had about a 60% sensitivity, which is terrible. So, but now we're looking at 97% sensitivity on some of these tests for this protein. So the benefit of that is now we can do it in less than 30 minutes most of the time because we skipped that amplification step. And it's going to allow us to now to do much more widespread testing, including any patient that's now admitted to our hospital will receive an antigen test for COVID-19 so we can make sure that they're placed on the appropriate ward when we get that test back. So this is big news. We have actually stopped the antibody testing. So remember, antibodies are those attack proteins the immune system makes against the virus. And part of the reason we've stopped that is after listening to a lot of experts, the concern was that people who were positive with an IgG or an IgM may be getting a false sense of security that they cannot get infected again. And we have no idea whether or not these antibodies really cause a person to be immune from getting the virus again. So at this point, we have actually stopped the antibody testing. In terms of our numbers, we are at 24 positives today. That is the number we've been close to for about the last 3 to 4 weeks. We have 5 patients in the intensive care unit. 4 of them are on ventilators. So the numbers in the critical care have looked very nice in the sense of being down typically no more than 5 patients in the ICU for about the last 2 weeks. Now, we have had 2 mothers who are COVID positive give birth to babies in the last 48 hours. And thankfully, at this point, we do not have any of these infants testing positive for COVID. There are reports in literature that the virus from mom can cross the placenta and infect the baby, but we have not seen that at our hospital at this point. With regard to the remdesivir, which is the medication we're using, we have about 225 vials, which is enough to treat about 45 patients for 5-day treatments. Right now, we actually have no one on that medication, and we've treated a total of 94 patients. And then with regard to our personal protective equipment, we're doing very well. We have plenty for our staff at this point. Just to affirm what Casey was saying about the CDC report. So we have almost 6 months of experience with this virus. I can tell you for the vast majority of patients that come in with COVID-19, if you look at their chest X-ray or the CT scan of their chest and their labs, you can say this person has COVID-19 before you even do the test. So we really see almost a classic profile on a lot of these patients. And most of these patients that don't do well, they progress to having advanced respiratory failure from the virus. So we know when people die from COVID-19. It's really not a big question, even if they have other medical conditions that may have made them vulnerable to infection or to do worse with the virus. Most of the time, it is very clear that the cause of death was the effects of the virus itself on the respiratory system. So that's all I have for today. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lementier, Chief Medical Officer for BSA. Dr. Lementier, how are you?
I'm doing well, thank you. Good morning. Glad to be back this week. First, I'll start off with some of our statistics here at BSA today. We're at 28 patients hospitalized and confirmed with COVID. 50% of those patients are requiring ICU level care, and 50% are on our med-surg unit, which is our COVID unit on the 5th floor. We have about 50% of the ICU patients requiring mechanical ventilation, and those statistics have held pretty steady now in terms of how these patients that end up getting admitted are breaking down in terms of what they're requiring as far as the level of care and the level of ventilatory support for the most critically ill. We have a couple patients that are under investigation currently, but those numbers have stayed low since we've been able to get adequate supplies of our rapid testing, which is the RT-PCR test that we can turn around in an hour. That's helped us tremendously in terms of how we get patients dispositioned to specific units. We're using about a little bit more than, a little bit less than about 50% of our ventilators, about 40% or so right now. And we're also using high flow nasal cannula oxygen setups on about 50% of patients that are not on ventilators, if you will. We've had a steady flow of patients coming through our respiratory triage department. And again, anywhere from 20 to 30 per day. And I think that's only going to increase as we approach flu season and we see more people coming in with respiratory illness that may or may not be COVID-19, obviously because of the nature of many different respiratory viruses that exist and tend to be more prevalent during the fall and winter months. That's a good time for me to remind folks it's critical to get your flu vaccination this season. It's critical to get it early. Better to get it early and potentially have us consider revaccination, which I know is being discussed amongst the medical circles, depending upon how things go later this year. It also will depend upon whether or not we have a COVID-19 vaccine that comes out either by the end of this year or the first quarter of 2021. There are a lot of folks putting tremendous efforts to getting those vaccines pushed out in a safe and effective manner. I want to talk about a couple other things briefly. First, remdesivir. Remdesivir is the antiviral drug that we're all familiar with in terms of communicating about that drug on this call on a weekly basis. It's been shown to shorten the length of stay of patients that are hospitalized. It has also been shown to improve the time to recovery, and both of those were statistically significant. There was not a survival benefit with the medication, however, but aside from that, the other 2 points mentioned are critical. Well, the FDA has recently expanded the emergency use authorization parameters around remdesivir, which means that there is now the capability for patients to be eligible for the drug if they are hospitalized, not only if they have severe disease. That doesn't mean that 100% of patients will get the medication. We do have good supply of remdesivir. We're getting allocated through the state, and we're purchasing 100% of that supply at this time that's being allocated. And again, we're trying to have that drug be used exactly per the clinical guidelines. And now with expanded EUA for remdesivir, it gives us a little bit better opportunity to treat patients that are not quite as critically ill, which may help them. We are also involved in a couple clinical trials for experimental therapies for COVID-19. One of those is Regeneron, and that's the antibody that fights against the spike protein on the coronavirus that hopefully prevents it from binding to human host cells. We've enrolled 5 patients thus far in that trial, and we will continue to monitor the outcome of those patients with a long-term longitudinal scope, if you will. This is a placebo-controlled trial, which is how trials should be done when you're looking at experimental therapies. From a testing standpoint, we've tested over 8,000 patients now since the beginning of the pandemic. The overall positive rate remains right around 17%. Month to month, that fluctuates. July, we had a higher percent of positives coming through, closer to 20%. August, we were down a bit, closer to that 13% range. We've had some students coming to BSA to the ER since the opening of school that are requesting testing, or their school officials are requesting testing. We would simply ask that we attempt to have the school's needs met by folks going to the appropriate level of care, meaning those individuals who are symptomatic that warrant ER evaluations. I think Dr. Weiss would echo my words here, and that is that if you're having significant symptoms that may require hospitalization, we absolutely want you to come to our ERs. However, if you're having more mild symptoms and or potentially just need a test, it'd be more appropriate for you to go to one of our urgent care centers or one of our ambulatory sites that is not the hospital. Part of the reason is that the workflow through the hospital is really designed for patients that are more ill, and that so that we can take care of those patients more expeditiously. We are also going to be looking at antigen testing at BSA, primarily for our ambulatory clinics. But secondarily, I agree with Dr. Weiss, there's a role for antigen testing in the hospital. It may expand the ability of us to test more patients through the winter months if our rapid testing supplies are in greater demand, which they probably will be, and we have any shortage concerns. So again, the newer data on antigen testing does show that if the disease prevalence in the community is around 10% or higher, there's a very good sensitivity and negative predictive value, which means that if you have a negative test, you probably don't have the disease. So that was not the original thinking with antigen testing. But again, it's tied to how prevalent the disease is in the community. So I think that really wraps up my commentary today. Thank you for letting me be part of the news conference.
Thank you, Dr. Lementier. Now I want to go with Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well. Thank you, David. First of all, I'd like to thank you for this opportunity to talk to our veterans in the Texas Panhandle area. Do want to say that currently we have 4 inpatients COVID positive here at the Amarillo VA. 1 is in the ICU, not on a ventilator, and 3 are on our medical surgical wards. We have 28 veterans that are home self-isolating that are COVID positive that we are tracking. And we do not have any veterans that we are waiting for a test result to come back. As I mentioned last week, we have increased our face-to-face appointments here at the Amarillo VA and all of our community-based clinics. And we continue to watch the COVID activity in the community to determine, make sure we're doing what is safe. I do want to echo, we still have telehealth options available for veterans who feel those options may be better if you and the provider all feel that that is the best way to get your care. We did have our town hall last week, and the biggest thing that came up was flu vaccinations or influenza vaccinations. And we are still waiting to get our supply of influenza vaccination. However, we are expecting it soon. And we are planning on having a flu drive, a flu vaccine drive, and more information will be coming out later on that. Once again, I'd like to thank our employees here at the Amarillo VA healthcare system. They're what's making it possible for us to increase those face-to-face appointments for our veterans, and appreciate what they're doing to ensure we are practicing the safe medicine as possible. And I'd like to thank the City of Amarillo for this opportunity to speak to my fellow veterans in the Texas Panhandle area. Thank you.
Thank you, Dr. Gonzalez. We'll now go to City Manager Jared Miller. Jared, how are you today?
Doing good. Thank you, Dave. I just wanted to add to what Dr. Lamentier said regarding testing and echo what Casey had said earlier. If, in addition to the testing resources that Dr. Lamentier mentioned earlier, there's also the city's drive-through testing site. If you feel like you have symptoms that might be coronavirus, please call our public health at 378-6300. You'll be screened to be able to go to the drive-through testing center. That's just another tool in your tool belt to be able to assess how you are doing regarding coronavirus. Also want to touch base on the governor's executive orders GA-28 and GA-29. With regard to GA-28, it allows no occupancy limits on essential critical infrastructure, religious services, local government operations, child care services, youth camps, and then also recreational sports programs for both youth and adults. Outside of those categories, everything else right now is allowed to be occupied up to 50%, with the exception of bars, which are still closed. I'll touch more on that in just a moment as well. With regard to GA-29, GA-29 is a standalone executive order from the governor relating to the use of face coverings during coronavirus, during COVID-19. Per GA-29, every person shall wear a face covering over the nose and mouth when inside a commercial entity or other building or space open to the public, or when in outdoor space wherever it's not feasible to maintain 6 feet of social distancing from another person not in the same household. There are some exceptions with regard to age, physical capability to wear a face covering, and other issues. Now, I mentioned that bars were still closed. At the direction of the governor, the TABC, the Texas Alcoholic Beverage Commission, has put out a temporary industry notice which allows bars to temporarily operate as restaurants. As I said earlier, the Texas Alcoholic Beverage Commission put out an industry notice that was dated August 25th of this year, allowing bars to temporarily operate as a restaurant during the COVID-19 pandemic. To that end, later today, the City of Amarillo Public Health District is issuing interim rules for the TABC licensed bars wanting to modify operations. Our goal is to be as possible in coordination with TABC guidance and also existing state statutes for operation of bars and restaurants. Prior to operation, facilities must demonstrate compliance, and this is minimum compliance, with the most recently issued TABC requirements and have the ability to meet the following minimal temporary food safety measures with regard to sanitation, storage and cooking, fire safety, training and knowledge, and then also on-site inspections will take place as well. The requirements, they're not the same all around because not every establishment is going to do the same thing. Some will have prepackaged food, some will cook food. So there's certainly some different requirements to be expected. But those requirements are going to match what they choose to do and how they choose it. So we're going to be as flexible as we can with regard to those, but there's no one solution because we don't know exactly how each one will do it. The interim operation rules will allow bars to temporarily serve food and be open as directed by the governor. Finally, our environmental health department is here to assist and support bar owners and is available to assist any establishment that wants assistance or guidance. I think the key is that environmental health is a resource. That's all I have, Dave.
Thank you, Jared. At this time, take questions from our media. If you have a question.
And we'll continue with the coronavirus coverage on air and online. For the latest, you can always log on to our website, myhighplains.com. For now, we'll send it back to programming.
Regarding yesterday's scorecard, it did show an uptick in cases. So I was wondering if this is something we can continue to expect, and what do we attribute that jump to?
So I think, any have groups gathering, we will certainly see increases in cases. And so as school is opening, we expect more cases. We appreciate all of the hard work that the schools have done to mitigate and to slow potential exposures, but we certainly expect some increase. And so we'd expect some, but we appreciate all of the hard work that the schools have done.
Thank you, Casey. And then talking about, children and students, I was wondering if the hospitals have seen any increase on children hospitalized with COVID, or if we've seen any more cases of the multi-system inflammatory syndrome.
I would say at Northwest, we have not seen an increase in pediatric cases, thankfully, at this point. And no, we have not had a second example of the multi-system inflammatory syndrome.
And I would agree, and I would concur at BSA, similar, not any increase in pediatric admissions for COVID-19, and as well, not seeing any further evidence or any evidence to this point of that syndrome.
All right, thank you so much. Lastly, are we looking at remaining at level orange for a while, or are we looking into moving to yellow? Any move on that end?
I think right now we certainly are, with the governor's current orders and the current state of transmission in our community, orange is an appropriate level. We're always evaluating and always looking. Our goal is to balance the opening but also this public safety aspects. And so we certainly understand that is a need in our community, but we want to make sure that we do that at an appropriate time. And so I think with school opening, we're going to need to make sure that we can see the effects of that as that plays out. And so once we see what's going to happen here with school opening, I think we'll have enough data to make that decision shortly. But with the governor's current orders and the state of transmission, orange is currently an appropriate place to be.
Okay, thank you. Those are all my questions. I appreciate y'all's time.
Thank you. Let's now go to David Gay of Amarillo Globe News. David, how are you today?
I'm good. Good morning, everybody. I guess the first question is just a clarification on Vanya's question. For the cases that are reported from school districts and from higher education facilities, are those added to the report card each and every day?
Yes, those cases are included in our total numbers.
Okay, fantastic. Thank you so much. And can you talk to me, Casey, a little bit about I know over the last few weeks, there's been a lot of conversation about flu vaccine and COVID-19. Can you talk to me a little bit about why, in your opinion, you think it's important for the city and all these medical entities to come together to promote getting the flu vaccine during this pandemic?
So I think, flu vaccine has always been a very important vaccine to receive. I think now this year certainly highlights that need. Co-infection with influenza and COVID-19 is certainly would certainly be a very devastating co-infection. And so we're glad to be able to come together to to promote the flu vaccine together. I think you hopefully have already seen some of the graphics and some of the media pieces that we have put together. We appreciate all of our partners to do that. I think that we have a lot of leverage and a lot of visibility when we come together. And so we appreciate that opportunity. But I think vaccines are certainly one of the public health successes 100 years, with being able to not see in our own children those diseases that our grandparents and great grandparents feared most, that we lost children to just in 1 or 2, 3 generations ago, that we don't lose our own children to today is something that is so valuable. And I think that it's a kind of an unsung hero, those vaccines are. And so flu is just another one of those vaccines that are so critical to get every year. And so I appreciate that question.
Absolutely. And I guess the next question that I have is, you talked a little bit about waiting to move to a potential other level, depending on when school, as the school numbers come in and such. Is there a kind of is it a timeline of when you expect to make that decision? Is there a certain time period after school begins where the public health department will start that conversation?
So we work together with our partners and city officials regularly, all the time. So we're always in conversation about that. I think that it's very important to have that timing just right, because once we open up further, and right now we're under the governor's orders, and so it's just our level orange matches those current orders. And so, but once we have that ability with the governor's orders to open up more and with the state of transmission here in our own community, I think that we'll be able to see some more flexibility. But right now, it's just that level orange is just an appropriate place to be.
Sure, absolutely. And I guess the last question is for Mayor Nelson and/or Jared Miller. With the numbers, you talked a little bit about the economic numbers and the economic impact being better than was what originally thought. Do you see that that sales tax number and that hot tax number continue to be steady through the end of the year, or do you see it fluctuating any as the COVID-19 pandemic continues through the end of the year?
Jared, you want to go first?
Yes, ma'am. I'll go ahead and jump in. I don't anticipate, and again, this is somewhat of a crystal ball, but based on our trends that we're seeing so far, I would anticipate a continued recovery based on performance versus previous years, up to those levels, moving back towards those levels and even beyond as we continue and actually go through this period. I don't see it fluctuating up and down unless we have a significant change in the national experience and especially in the local experience with regard to coronavirus. And I see that for both sales taxes and for hotel occupancy taxes. Both are recovering along a pretty consistent slope.
Yeah, and I agree. It is somewhat of a crystal ball question, but I would add that it's our choices that are going to affect those trend lines. And so if we as citizens will come alongside and do the 4 or 5 things that our medical officials are asking us to do, which is wash our hands, stay home if you have any symptoms, wear a mask. Doing those things is going to affect our trend lines. So our trend lines are looking good right now. And I think those will hold strong through the end of the year, because I think we're going to make wise choices and we're going to consider others in those things that we need to do, not just to take care of ourselves, but most importantly, to take care of our city. So I do agree with what Jared's saying, that I think we'll see those stay strong through the end of the year.
Absolutely. That was my last question. Thank you, guys. Have a good rest of your week. Thank you, Dave.
Thank you, David. This time, let's go to Aaron Langston at KEMR Channel 4. Aaron, how are you today? Good. How are you?
Yeah, I can say that it is a trial that is looking at a drug compared against placebo, and then the other usual standard care that's provided for COVID-19 patients to determine if this antibody that attacks the coronavirus spike protein will have a positive effect in terms of either improving mortality for these patients, reducing the severity of disease, or other potential COVID-19 complications. So again, similar to other trials that look at unique drugs, it's best when you do those against a control group that is getting a placebo. The study needs to be blinded so that the patients and that the providers don't know whether the patient is getting the real drug or the placebo. And the patients obviously have to give full consent and agree to participate in the trial, again, for us to proceed with any particular individual. So that's the basis of it. I would say that it'll be likely months before we see any data that comes back to say whether or not this drug or others that are being looked at in a similar fashion have been effective.
And I guess the biggest thing is we do believe that the availability of the testing will be much better than the PCR testing we've been doing. So as Dr. Lamentier mentioned, both hospitals have been using this one test from Cepheid, this PCR test, and I can tell you that we ran out yesterday. We hope to get more in tomorrow. So it's just been variable as to how many tests we can get in at any given time. So we really think the antigen testing is going to be much more available, and then that turnaround time is just be essential in terms of having people be able to come in and literally wait in their car for the test, as opposed to having to go home and us contact them later.
That's correct. The availability is a key factor. I agree with Dr. Weiss. The quick turnaround time, even faster in some instances than the PCR testing. And the PCR testing, it's very sensitive. It's very specific. The one potential downside, other than how it's obtained, as was mentioned in terms of the sample being difficult, is that there is something called a cycle threshold, which during the amplification process, where we're trying to determine if that virus is present, there's been some recent press that's talking about where this cycle threshold is set. And the bottom line is, it's believed that there is a proportion of patients that are truly positive, which means they were infected at one point, but they may not have a very high viral load. And if they don't have a high viral load, that really translates to less risk for infectivity of others. So the question becomes, what's the ideal threshold to be set? And I think there's still going to be some debate there about amongst virologists, amongst the vendors that manufacture these tests, where we should be setting that threshold. And I'm not sure that we know that at this point.
We don't have any grants or any financial assistance if that's the focus, but we do have personnel through our environmental health department that can help guide them through the things that they're going to have to think about when they're deciding what type of food they're going to serve, how they're going to serve it, how they're going to keep it, how they're going to sanitize the facility, how they're going to train their employees to be prepared in food handling and things like that they might not have done before if they weren't serving food. So we have lots of assistance, and that's what I want to put out the most. Environmental health is the best resource you can have in this situation. Our focus, and sometimes people are a little reluctant to call environmental health because those are the people that do your food safety inspections. However, our goal is to be as flexible as we can possibly be in coordination with the intent of the TABC's order, with the intent of their industry notice. Which was done at the direction of the governor. Governor wants the bars to be able to operate, but is uncomfortable with allowing them to just go out and operate as a bar. And there's some reasons for that, and there's some science behind that. But the primary goal here is for us to be as to facilitate their efforts to get back to operations as much as possible.
And I would add to that while there aren't grants available for those businesses by that category, there are small business grants available, and it may be that one of those businesses would qualify. There's a public safety reimbursement grant. There are other grant programs. And so I would direct every small business owner, including those who might be in the category of owning a bar or a restaurant, to the AmarilloAlerts.com page. And there's a tab at the top. They can get more information. They can even fill out the application or get that application on that website. So the city has designated well over $500,000 in funds to help small businesses locally, and there are still funds available. So, but they're going fast. If you're a small business owner, please take a look at that grant application if that's something you think would be helpful to your business.
Yeah, that's a great clarification, Mayor. While we don't have anything specifically allocated for this process to be able to temporarily operate as a restaurant, we have multiple different grants that are available to any business across town to help them with costs associated with.
Thank you, Aaron. Let's now go to Dalton Williams of KVI Channel 7. Dalton, how are you today?
I'm good. Thank you so much. Thank you all for having me. I really kind of only have one question, and it's directed kind of towards the doctors. So I understand that vaccine trials are underway, but yesterday it was announced that the U.S. will not be joining the World Health Organization in efforts to develop and distribute a vaccine for COVID. So I guess my question is, do you think that politics could get in the way of
Dalton, if you could speak up just a little bit. Dalton, we're having trouble hearing you. I don't know if the doctors can hear you or not. If you could speak up just a little bit, please.
Sorry, can you hear me now?
Doctors, can you hear him?
Sorry.
Yes, thank you.
Go ahead, please.
Okay, so sorry, the U.S. announced that they aren't joining the World Health Organization in developing and distributing a vaccine for COVID. And I was just wondering, do y'all think that politics could get in the way of finding a good and potent vaccine for this pandemic?
No, I guess I'll start with my comments that you know, whether or not the U.S. partners with WHO on a vaccine and the distribution of a vaccine or not, I think is yes, potentially a political question. However, I would add that there are numerous trials ongoing with different types of vaccine platforms in the United States. There are multiple vaccine manufacturers, drug companies / vendors that are doing very good work with our government, setting some tentative deadlines, if you will, that they're hoping to have vaccines marketable and distributable. Again, I think the approach would be for healthcare workers and the highest risk individuals being vaccinated first. Once the vaccines get through phase 3 trials without evidence of significant adverse events and evidence of a positive impact in terms of preventing infection. So again, we need to wait for the data to come out that is good data. It looks like the earliest that could be is the end of this year. I wouldn't be surprised if it's beyond that. And I don't feel like that lack of potential collaboration with WHO is necessarily going to impact our ability to get vaccines.
Great. You know, personally, I don't think there's any human activity that's free of politics. So yes, I of course it's going to affect this, but I would agree with Dr. Lamentier. I think the concern here is you know, everyone wants to be the first to the finish line. And so all these different countries and companies are working on this, and there has been a lot of great collaboration. But I know also that there was talk from the federal government that they might consider suspending or shortcutting some of the typical steps in approving a vaccine for this one in particular, namely that as they go into these phase 3 trials, they may not actually wait till the end of these trials to decide if they're going to approve this vaccine. We just have to be very careful about that because, you know, Dr. Lamentier talked about 2 weeks ago, the steps in this process are essential to assure that not only is it effective, but that it's safe. And so it's critical that we give ourselves the time and our researchers and companies the time to make sure that both those goals are met, safe and effective. So yeah, we're all hopeful that it will come out, by the end of this year, or early next year. And as Dr. Lamentier was saying, I think there'll have to be a prioritization as to who gets the vaccine first, maybe first line healthcare providers or people who are particularly vulnerable to the vaccine. We're making a lot of progress, but we just always have to have that healthy caution as to making sure that it's an effective device before we distribute it to the mass populace.
Okay, awesome. Thank you. That's really the only question that I have. I hope you'll have a great rest of the day.
Thank you, Dalton. At this time, this concludes our news conference for today. I want to thank all of our panel members for taking the time out to participate and providing this information to the community. Once again, this is David Henry. I'm the Communications Manager for the City of Amarillo. We have these Zoom news conferences every Wednesday at 11 a.m. We'll see you by next week. Thank you for participating and have a good week. Thank you.
Thank you.
Thank you.